Hi guys, today we're gonna look into lead poisoning. So before getting into lead poisoning, I would like to introduce myself. I'm Jivika Mohan, a first year MBBS student at Madras Medical College, located in Chennai, Tamil Nadu. So I secured an all India rank of 747 in the NEET UG 2023 with a mark of 690 on 720. I also cleared JEE mains with a percentile of 99.04. I'm currently an NTSC scholar and I've also qualified KVPY and NMTC. So let's move on to the topic. So, what is lead poisoning? Lead poisoning, also referred to as lead toxicity or plumbism, is nothing but the buildup of lead within the body. So, lead is a heavy metal, and one should always remember that no level of lead within the body is safe. Why is it so? Because lead does not have any physiological function to play within the body, and it also interferes with the normal metabolism of the body. So, therefore, we regard lead as an environmental toxin. Children are more prone to lead poisoning than adults. Why is it so? This is because children have an increased hand mouth behavior. By hand mouth behavior, I imply that children tend to keep stuff that they come into contact directly into their mouth without a second thought like adults. So, therefore, they have higher lead exposure, and also they have an increased lead absorption from their intestine. So, there is an increased efficiency of lead absorption from various sources, and this is worsened by the fact that they have an immature liver detoxification system. So, due to these factors, we regard that children are going to have a higher chance of getting lead poisoning than adults. And lead also has the ability to cross placenta. Therefore, lead poisoning is also going to be seen in a pregnant mother and her fetus. So, lead poisoning can be defined as an acute condition or also as a chronic condition. So, as an acute condition, it is basically an occupational disorder. Like people employed in battery manufacturing, mining, construction workers, since they are exposed to lead on a day-to-day basis, they are prone to lead poisoning. And these occupations, since they are going to employ the male population more than the female population, therefore adult males are more prone to lead poisoning. When we discuss lead poisoning as a chronic condition, it can occur in children as well as in adults due to lead exposure from various environmental sources. Environmental sources include leaded paints, leaded gasoline, water, and soil. Even though leaded paints and gasoline have been phased out in the recent times, lead from these sources has infiltrated the soil, which in turn has entered the groundwater resources and also into the atmosphere, so thereby increasing the chances of lead exposure. Also, old leaded paints present in the house, various houses, can also cause lead poisoning because the chippings from these paints are a source of lead exposure. And also, children's, particularly infants, who are going to play with old toys which are painted with leaded paints, are also prone to have lead poisoning. So, a particular case of interest in lead poisoning would be our gunshot wounds. So, let's say a patient who has suffered from a trauma due to a gunshot wound has a retained bullet fragment. What is the reason for this retained bullet fragment? This could be because the removal of this fragment could have required extensive dissection of the patient, which could be of more harm to the patient. So, therefore, it is better that the surgeon leave it as such. So, the retained bullet fragment could be present in a gunshot wound, and lead poisoning can arise from this as a medical complication. So, how does it happen? The retained bullet fragment is a source of lead, and this lead is going to first diffuse into the bloodstream, from where it enters the soft tissues and later on accumulates in the bones. So basically, it inhibits the sodium potassium pump. So by inhibiting the sodium potassium pump, our lead is going to affect the neuronal transmission, and also it is going to bind to calmodulin, thereby affecting the calcium metabolism. So if I take a radiographic study or an x-ray of such a patient, I can see radio opaque densities. So as you can see, there are many white spots. These radio opaque densities are due to the accumulation of lead within the body. So coming to the pathophysiology of lead poisoning, lead is going to interfere with three main processes. One is heme synthesis, the second being the metabolism of reactive oxygen species, and third is its competitive nature with calcium. Let us look into each of these one by one. Starting with heme synthesis. So this is the heme synthesis pathway over here. As we can clearly see that our lead is going to inhibit two major enzymes of this pathway, one being the ferrochelatase, right, the other being ALA dehydratase. Both of these are going to be inhibited by lead. So if they are going to get inhibited by lead, so naturally we can say that the substrate concentration is going to increase. So therefore the substrate alpha delta aminolevulinic acid is going to increase, and also the substrate protoporphyrin level is going to increase, due to which they accumulate and get excreted in the urine. This is also going to cause a decrease in the heme synthesis, right. Moving on to let's interference in reactive oxygen species metabolism. Reactive oxygen species. So by this reactive oxygen species, I refer to the free radicals and peroxides which are present in the body. These free radicals and peroxides are produced in the body as a part of the process of apoptosis. So this is done to remove the damaged cells from the body, and these free radicals and peroxides are going to bring about a cell membrane damage, due to which the cell is going to undergo lysis or death. So to remove this free radicals and peroxide, that is the reactive oxygen species, from our body, we have two particular mechanisms. One is through the enzyme superoxide dismutase, and the other is through the antioxidant glutathione. So our glutathione is going to get combined with reactive oxygen species, and glutathione is going to get oxidized into glutathione disulfide, while the reactive oxygen species is going to get reduced to an alcohol. So our lead is going to inhibit this enzyme superoxide dismutase, and it is also going to interfere with this pathway of glutathione's conversion to glutathione disulfide, thereby increasing the level of reactive oxygen species within the body and causing an increased cell membrane damage. And last, coming to lead's competitive nature with calcium. So over here we can see that this is a synapse. Our body has numerous synapses, right? So the presynaptic membrane is going to release certain neurotransmitters which are going to reach the postsynaptic membrane, and the postsynaptic membrane, to inform the presynaptic membrane about the arrival of this neurotransmitter, it releases another molecule which we refer to as the BDNF, or the brain derived neurotropic factor. So once this is going to inform the presynaptic membrane about the arrival of the neurotransmitters at the postsynaptic membrane. So to synthesize this BDNF, our postsynaptic membrane requires calcium. Calcium has to enter this postsynaptic membrane so that BDNF can be secreted out into the synaptic cleft. But our lead is going to inhibit this entry of calcium by binding to calcium receptors on the postsynaptic membrane, and thereby it is going to affect this BDNF formation and transmission, thereby causing an impairment in the neuronal transmission. So due to these various pathophysiologies, lead is going to cause numerous signs and show numerous signs and symptoms in various systems, which we'll discuss one by one. Starting with the hematological signs and symptoms. So in the hematological signs and symptoms, we have microcytic anemia. That is, we already know that there is a decreased heme synthesis in case of lead poisoning, as we have discussed under heme synthesis pathway. So due to this, we can see microcytic anemia in the patient. That is, the mean corpuscular volume of the patient is going to fall below 80. This indicates microcytic anemia, but this microcytic anemia, unlike other anemia, general anemia, is not going to be accompanied by a decrease in the iron level. Instead, we see a normal iron studies. This is because the Iron metabolism is not going to be affected by lead. So therefore, the iron studies of such a patient is going to remain normal. Lead also interferes with the RNA degradation. So if RNA is not going to get degraded, it is going to accumulate on the RBCs and give it a base an appearance which we refer to as basophilic stippling. Basophilic stippling. So as we can see, there will be a numerous purplish dots all over the RBCs because of the RNA accumulated over it. Moving on to gastrointestinal signs and symptoms. Under gastrointestinal signs and symptoms, we can see that the patient has abdominal pain, nausea, vomiting, diarrhea, and also constipation, which is particularly seen in case of children. Under neurological signs, we can see that the patient has encephalopathy. Encephalopathy refers to an altered brain function. That is, the patient is going to have an increased irritability, aggression, and a decreased concentration, and also a significant fall in the IQ values. Right? The patient, due to peripheral neuropathy, that is, lead is going to affect the peripheral nerves like radial nerve neuropathy, is going to cause wrist and foot drop. Right. Then moving on to renal signs. Under renal signs, we can observe Fanconi syndrome and lead nephropathy. Fanconi syndrome is due to the tubular degeneration. So the tubular cells are going to get degenerated, due to which there is phosphaturia, increased phosphates in the urine, glycosuria, glucose in urine, and amino aciduria. Amino acids are present in urine, right? So due to this, we can observe these, and this is referred to as Fanconi syndrome. And the lead nephropathy, we see that there is nephritis within the patient's kidney, and also vitamin D's conversion into its active form takes place in the kidney. So due to lead nephropathy, there is a decrease in this conversion of vitamin D to its active form. And hence there is a defect in the vitamin D metabolism. Moving on to reproductive signs, we can see a decreased libido. Libido refers to sexual behavior. There is infertility seen, and since lead has the capacity to cross the placenta, we can also see miscarriages and stillbirth in such patients. Coming to cardiovascular signs, there is hypertension and increased risk of cardiovascular diseases as well as stroke. So how do we diagnose these diagnose lead poisoning? To diagnose lead poisoning, primarily we determine the whole blood lead level. As I've already mentioned, any level of lead within the body is going to be harmful, but still, to cause a significant damage, the lead level should be more than 5 micrograms per deciliter, and a value of 10 to 20 micrograms per deciliter requires an immediate removal of the source of lead exposure and also retesting of the subject. We can also determine the free erythrocyte protoporphyrin levels, since we already know that in lead poisoning, protoporphyrin levels are going to be elevated because of the accumulation of protoporphyrin. When we do a complete blood count, we can see microcytic anemia with normal iron levels, right? And also basophilic stippling is seen in a peripheral smear, right? So another characteristic feature of lead poisoning would be the lead lines. Lead lines, also referred to as Burton's lines, are nothing but these blackish blue lines in the gingiva of the mouth, and also these white lines in the epiphyses of long bones. So these lines are due to the accumulation of lead within the body, and the thickness of these lines is going to indicate the extent of this accumulation. So accumulation is directly proportional to the thickness of these lead lines, right? So how do we treat such a person? first primary treatment would involve identification of the source of lead exposure and removal, followed by, in severe cases of lead poisoning, we do chelation therapy, wherein chelating agents like EDTA, dimercaprol, and succimer are given, which are going to bind to lead. They bind to lead and they are going to cause an increased excretion via urine. So thereby lead within the body is going to get excreted via urine. And also a procedure called gastric lavage is performed in case lead containing object is ingested. So in this procedure, a nasogastric tube, as the name indicates, naso via the nasal cavity, it is going to be sent to the stomach, gastric. So nasogastric tube via the nasal cavity, it is going to go into the stomach, and the stomach contents are going to be suctioned out. So therefore we see that the lead containing object is also going to be suctioned out. And we already know that the vitamin D and calcium levels are going to be affected in case of lead poisoning. So supplements for the same can be given. Thank you.